Welcome everyone to this webinar to talk about a very important topic in our animal welfare response to the COVID-19 pandemic. That is the topic of spay-neuter and how we adapt to serving the animals with their urgent needs while still protecting our staff and communities from the spread of this virus. I am pleased to be joined today by several colleagues in animal welfare who are well known to all of you. There's Aimee Arnaud, who is Director of National Veterinary Programs for Best Friends Animal Society. Dr. Stacy Cannon, who's Medical Director of Metro Animal Control in Nashville, Tennessee, giving us the perspective of Municipal Animal Control Agency. Sharon Harvey, President and CEO of Cleveland Animal Protective League, who will give us the perspective of a nonprofit organization, and my colleague, Dr. Kate Hurley, Director of the Corette Shelter Medicine Program at UC Davis, who's going to be able to share some of the most recent information that's emerging, as well as help us understand how to handle cats in this crisis. I wanted to start with this picture from Facebook because I thought it told so much of the story that we're going to be delving into in this coming hour. This is a doctor who works in the emergency room, and he hasn't been home for 2 weeks to see his family. He can't come in to see his son because he's been in the hospital exposed to infected people, and he wants to protect his family, who is sacrificing along with him to help make sure that people who are sick are getting the care they need in hospitals. But we also know that this hospital capacity is in danger of being overwhelmed by the new infections that are coming so quickly. And what his wife asks in this Facebook post is for people to stay at home so that there aren't more infections and their father can come back to their family. And I'll give you just a little bit of doom and gloom projections here so that it puts into perspective why we are making some very drastic recommendations. This is a model that you can look up online and look at your own state to see where it falls in what is a projected point of no return for overwhelming hospitals. The dashed line that you see is the capacity of hospital beds. This is Florida, for example, because that's where I'm calling in from. And so we expect that the number of cases, if nothing is done, is the red curve, will exceed hospital capacity in mid-April. Our state is doing a loose interpretation of social distancing. You can see on the internet that we're still having crowded beaches, so we're not being very good at locking things down. But if we were to get more effective at 3 months of social distancing, we would not exceed hospital capacity until the end of April. So it would flatten the curve somewhat, but not save us. However, the green curve is where we really need to be. That's 3 months of shelter in place. That means people stay home from work and they only leave their home for urgent tasks such as buying groceries or going for medical care, but it is not routine activities. And then the purple line, which is the best case scenario, is something that we probably won't face in this country, which is 3 months of lockdown as they did in Wuhan, China. So this means police are out chasing people off the streets, and they even threaten the death penalty if people left their homes. But we can do 3 months of shelter in place and make sure that everybody who needs care will get a bed in a hospital. And not to be over dramatic again, but I know that a lot of us have great respect for Ellen Jefferson, who's the director of Austin Pets Alive and a great leader of the no-kill movement. And she is not one ever to shirk away from anything that can help save animals. And she recognizes very clearly that our ability to save more animals depends entirely on our ability to keep our organizations functioning and our staff and volunteers safe, so that they are ready when the pandemic is over and we need to roar back to full activity. She says, what that means to me is that while we know there are communities in America that are not yet on shutdown orders, it is highly likely they will be soon, probably in the next week. And unless every community wants to become like New York City, with makeshift morgues in the street because the real ones are too full, we as animal people need to take the people effect of our continued work very, very seriously. And this means that even though we as veterinarians are very creative in overcoming obstacles like not enough PPE, that's not the problem. I know we can make our own PPE and recycle gloves and find other ways to get surgery done, but we need to send our staff home because they're highly at risk when we come together to do routine procedures like spay and neuter. Even if we have curbside check-in for the public, it's the OR in the facility where the most risk occurs. We also know that people can become infected and lack any clinical signs but still spread it to other people. So if we come to work and we become infected and don't know it and then go to the grocery store and go to other activities, we can spread it, and the people we impact will never be known to us, but they will be harmed. This is a picture from one of my favorite projects that I've had in my career, and that's Spayathon for Puerto Rico. If we stay strong together through this incredibly sad and frightening time, we can be healthy and our organizations can be intact, and we can come back on the other side to create these programs that are bigger and spay and neuter more animals than we ever did before. We can come back better, and we already have national organizations working on how this is going to be accomplished. So we need to swallow the bitter pill now, hold off for a couple months, and know and trust in us that we are coming up with ways to recover so that we are not permanently set back from all of the great work we've been doing in spay neuter. And we are fully cognizant that this comes at the beginning of kitten season. It couldn't be a worse time of year, but the virus didn't ask us how to affect us. I gave a presentation to animal shelters last week about what I thought were the most 5 critical takeaways as animal shelters shift from being a regular business that we're all used to in the community to being emergency only. They're now first responders, and they have turned communities into the animal shelters. We obviously have to preserve critical functions, and this is really the first time that we've ever had to define for the whole country what the critical functions of animal shelters are, especially animal control, and they really do rely on keeping animal control available as first responders to respond to sick and injured animals, safety issues, dangerous animals, and to support law enforcement functions if needed. And by the same token, to suspend non-emergency functions. What can we get by with by holding off a little while and pausing a lot of our normal functions that we didn't think of as being non-urgent? There was a call to reduce shelter populations, and this was critical because we know that there's going to be staff shortages as people get sick and have to stay home. And so shelters were amazing at asking their community to come forward like never before to take animals home on foster or to adopt animals. And there were lines outside of shelters, properly socially distant, so that they weren't spreading any of the virus in line. But there has been a record-setting number of adoptions and fosters happening in the last 2 weeks. And this is a lesson that we'll take forward as a success story in the future. At the same time, shelters are preserving their life-saving practices, so that it's been a very creative moment for animal sheltering to figure out how to not give up any of the gains in life-saving while emptying the shelters, reducing staff, reducing access to veterinary care. And then finally, our shelters have had to figure out how they can safely handle the animals that are coming from the homes of people who are infected with COVID. And this is a rapidly changing landscape as new information comes out almost daily on a few infected animals in other countries and what the proper PPE and holding periods would be. And we're not going to have time to get into that today, but we will give you some references so you can look up the topics that are outside of spay neuter that are really important. And it is very hard to pull out just spay neuter from the conversations because all of these other topics are intertwined. So just a quick recap of where we are in animal sheltering. We think there's about 5,000 animal shelters in this country and an unknown number of rescue groups, foster groups, and sanctuaries. They're caring for about 3 million dogs and 3 million cats a year. And we know that we've made great gains in life-saving for those animals, more so for dogs than for cats, but things are catching up for cats, and we don't want to give up any of that during this emergency. We also know that shelter intake can double during kitten season, March to August, which is right now. And in a good year, that stresses critical shelter capacity, and it's certainly, this isn't a good year for us. So we are going to have to be very diligent in finding and identifying alternatives. Shelters have been told that they need to plan to have 50% or more reduction in their workforce due to home quarantines, shelter-in-place orders, and actually staff becoming infected. And at this time, there is no evidence that pets can transmit COVID-19 to people, but that time may be coming, and that will be something that we will need to deal with, both from controlling concern in the public and also making sure people stay safe as they get more animals in from exposed households. I love this quote. This is from Kristen Auerbach, who's the director of Pima Animal Shelter, which is a very large open admission municipal shelter, and she has emerged as quite a leader in helping us navigate this landscape. And she says we must move faster and be braver than ever before. And when we talk about reducing spay-neuter, with this audience for which spay-neuter has been such a part of our DNA, I ask you too to be thinking about moving faster and being braver in our decisions to come. So what are the critical functions? Animal sheltering, certainly our animal control officers are out in the front line, responding in the field. They're scared. In surveys from the National Animal Control Association and on their Facebook page, when the question is asked, what are you most concerned about right now? Some of them said they're concerned about dying. They're out in the field with the public doing their job like other first responders, and we need to be there for them and make sure that they are getting the support they need, which means, again, saving the PPE for them and making sure that our shelters can accommodate the animals that they are bringing in. So the critical functions identified by NACA include designating animal control, animal shelters, and veterinary clinics as essential services. This is important as more shelter in place and stay-at-home restrictions are being rolled out across states, is we do need to preserve these functions and have them recognized as activities that need to go on. However, as in our veterinary clinics especially, that doesn't mean that we do all of our normal services. We need to roll back to emergency coverage only. And we're very fortunate now, we're starting to see some lists be developed to help guide what is an emergency service and what is a service that can be postponed. And we will share those documents with you. Assisting law enforcement is important. This would happen in cases of like cruelty complaints and other investigations, or going into households where an owner has been taken to the hospital or has died and their pets are left behind. Injured and sick strays still need to be picked up. Cruelty and neglected complaints need to be investigated. Dangerous dog complaints need to be handled and dangerous dogs removed. And then we still have to have capacity for protective custody animals. These might be animals that are seized from neglectful care or domestic violence situation where the pets need to have a break, or again, it could be the pets from infected households that can no longer care for them at this time. There are great guidelines being rolled out, a few a week now from NACA, that really give us excellent marching orders, and you can find those all at nacanet.org, and we'll be sharing the links in the chat and sending out links afterwards. This quote from the mayor of San Jose really is the one that gave me my marching orders. He said, "The time for half measures is over. History will not forgive us for waiting an hour more." This is an image from the TNR program in our local community. This is Operation Catnip. This is a caregiver that we work with very closely who has brought us cats, and then we also have supported her caring for the cats with food. She is a compassionate individual. She needs support. She's also in an age group that is highly at risk for very bad outcomes if she becomes infected. And we made an early decision in Operation Catnip to suspend our TNR activity. That's all we do. This is very hard for our organization. It means that we are going to be facing financial trouble because of a lack of revenue. We have a staff we're very concerned about, making sure that they still have a livelihood while we're not doing the one thing that we do. But we felt strongly that we had to keep people like this caregiver and our staff safe so that when we open up, we can catch up and operate even bigger than before. So TNR, we feel, is not an emergency activity. We are still available for emergency care of community cats, so we have been taking care of some critically ill or injured cats, but we can do that with a very reduced staff very safely. So these are some of the lists of activities that are now considered non-emergency, especially for animal control. So non-aggressive stray pickup. It is not essential right now that every free-roaming dog and cat that is not causing a problem be picked up and removed from the community and brought to shelters. Leash law and not licensing complaints, barking and nuisance complaints, those have to be suspended. Trapping and transporting of community cats, mitigating conflict around neighbors, and public spay and neuter and wellness clinics. This is probably the most appropriate item for this audience and today's discussion. And then we're working on really stepping up telemedicine and other ways that we can support all of these foster people, many of whom are very inexperienced and may have taken in pregnant cats or pregnant dogs and cats, and haven't had the experience before of having litters. And we know we need to develop new remote opportunities to support these folks, as well as maintaining our emergency services. So these are some additional links that are really helpful. The Worms and Germs blog from Dr. Weiss in Canada has been excellent at keeping us up to date on public health and veterinary and shelter operations. And then Neck and Neck again helps us determine what is emergency and not emergency. So just to give you a couple ideas of what this is looking like across the country as executive orders come out to shut down and stay at home. This is one from Oregon, where they defined emergency surgeries or elective non-urgent surgeries. Keep in mind that a procedure or surgery is exempt if a 3-month delay in the procedure or surgery would put the patient at risk of irreversible harms. So what they're saying is if we can put it off for 3 months and not harm the patient, that is considered elective. Criteria for determining whether irreversible harm exists are really clearly spelled out, and they're quite dire. Threat to the patient's life, threat of irreversible harm, permanent dysfunction, metastasis of cancer, or rapidly worsening or severe symptoms. And then another example here is from the North Carolina emergency order, where they remind veterinarians who are staying open that the shelter-in-place and stay-at-home decrees were put into place for a very important reason. It's important for all DVMs to realize that being deemed as an essential business comes with an important responsibility. Please do your part to help mitigate and control this deadly virus. Don't forget that the services that you include as essential will potentially place the following people and their families at risk: the client, your employees, and yourself. So when we got all of this feedback and really did our own inventory of what we thought was emergency, it was clear to us that spay-neuter did not make that cut, that routine spay-neuter surgery should be, surgery should be reserved for animals that have life-threatening conditions. Spay-neuter needs to be paused to preserve resources, and we do, as a profession, kind of get hung up on the fact that we don't use a lot of PPE, and maybe the local hospital doesn't need our PPE yet, although they might soon. That's really not the main objective. The main objective is to protect our own people and our communities and to flatten that curve so our whole country can get back to work faster. So this created some real dilemmas for us and challenged a lot of the traditions that we have come to expect. One is neuter before adoption. That has been a mantra for several decades now, and we have shocked a lot of our colleagues by saying, do not hold animals in shelters longer for neuter before adoption. Just adopt them or replace them with spay-neuter agreements. And the good news is compliance with these spay-neuter agreements is much better than it used to be. And also all the big software companies for clinic management and for shelter management have developed mass management tools to track these animals that have already been placed without neutering and to start automatically scheduling them when the crisis is over, to track them and to do reminder systems and scheduling. So we're going to have help from the software companies that we didn't have in the old days. Also, there was a nice story out of Texas when after Hurricane Harvey, when Houston flooded and thousands of animals were put into homes as fosters or adopters very rapidly with very little preparation. And then after the disaster, when there was follow-up to bring those animals back for neutering, the vast majority of people had already gone and had the animals neutered themselves. So this is a culture that we have now, that the public is really very aware of neutering, and we're feeling like these neuter agreements are going to be much more successful than in the past. No, they're not going to be perfect. We're going to miss some, and there's going to be some reproduction. This is a crisis that we have to address. The gut punch for me is pausing trap neuter return at the beginning of kitten season. We know that every female coming in now is pregnant, and every female that we leave in the field is going to produce some kittens, and that's going to produce a setback for our spay-neuter programs. But we just have to pause, and I promise you we're coming up with ways where we're going to catch up, and we're going to expand spay-neuter capacity and TNR capacity like we've never had before. We certainly do not want any shelters to euthanize animals because they can't neuter them before adoption. And we actually have heard of an example of this where a shelter interpreted their local law that said animals have to be neutered before adoption to be so inviolable that the only option they had when they closed their shelter was to euthanize animals. And we want to make it very loud and clear that that is not our recommendation. We also don't want animals held in shelter longer to wait for spay-neuter capacity to be available. So really we need to get those animals out of the shelter and reduce the shelter population as quickly as possible. And so everyone is getting exemptions right now from the neuter before adoption laws that may apply to them. This is a quote from an animal control director in Florida who really had invested a lot in building up their TNR program, and it was having a huge impact on live release in their shelter. And she says, we were making fantastic strides, and this is a gut punch to me. And that is how we all feel. I do want to give a little tip here that there is, for those of you who are placing intact female cats in homes, that there is an oral contraceptive that we can use on an emergency basis to suppress estrus in these cats. You can go learn about this at the Alliance for Contraception in Cats and Dogs. Do understand that this is an emergency situation. This is not something that we recommend long term, but especially for those who are placing whole litters in homes and they may have intact males and intact females together, and we want to make sure they're not breeding in our foster homes, that you can use this pretty cheap drug to suppress estrus very effectively in female cats. You can get this from compounding pharmacies, and the ACC&D is going to have all of the details that you need to know to use this. And this gives us just a little bit of relief from one of the stressors that we have with placing all of these unspayed cats. And I'm now going to switch gears a little bit and ask our panel to, I guess we're going to try this interview approach. I'm going to start with Aimee St. Arnaud. A lot of animal welfare workers and volunteers are feeling very sad and stressed about kitten season and all of the pregnant cats this time of year. They're worried about all of the unaltered cats, how we'll ever get open again and get caught up, and about all the progress that we've made being wiped out. What can you tell us about how the national organizations are preparing for the expanded needs for spay-neuter when the pandemic subsides? And Aimee, I'm going to advance your slides, so just let me know when to click.
Okay, thank you. Well, I think for me, like when I see all this flatten the curve talk, we've been looking at as a field of flattening the kitten curve for so long. And now I don't know how you feel, but for me, it's like watching that rise is just filled with anxiety. And, you know, Dr. Levy and I both started our clinics. And so 20 years, I've just been a spay neuter girl. You know, you're the one who walks down the street and you're looking for the dog testicles to see. And you're the one trapping at midnight under the bushes and hosting spay-a-thons on weekends in your spare time for considering fun. And so, you know, I think that the joke in our field has been that a lot of us like animals better than people. But I think it's a time like this that we realize that without our people, we can't do this. And so for me, that's what this is about. And I think before I kind of get into, I do want to give you some bright spots because I don't want this all to be doom and gloom. So I'm really going to talk about some things that I'm excited about that are coming, that are hopeful. But I think that the first thing I want to talk about is that I think we need to acknowledge it's okay. I've talked to directors who are crying because they founded these organizations. They're now scared if they're going to be able to survive, how they're going to pay their staff. Like, put your heart and soul into this. Like, I think we need to cry. Like, we need to take this moment to say, you know what, this effing sucks. Like, this is all this progress we've made in the past 17 years of when tens of millions of animals were being killed. Like, it's okay for us to like take a moment to acknowledge how much this really does suck. But I think then we need to not get stuck in that. And because we need to really focus on, all right, what are we going to do when we get back up and running? We've solved this before. We are a field that is innovators, and this is our time to really innovate. We're seeing it in shelters, and now it's time to create it in spay neuter. And to really think about, okay, there's been times when spay neuter stopped before, whether it's tornadoes or weather related or floods or hurricanes or winter weather. We've had it stop before, and we need to come back stronger. And I think Spay-a-thon in Puerto Rico has taught us a really interesting thing, is that they did 50,000 surgeries, and it was a heck of a lot of work, but it was really in only about 42 surgery days. So think about that. Think about how far ahead they came in just 42 surgery days. So we're definitely going to be back behind the curve when we start. We're going to be overwhelmed. There's going to be a lot more demand. People are going to need a lot more financial help. There's a lot of stuff we're going to have to figure out. But I really think it's time we focus on the bright spots. So I just want to go into a couple of those really fast for you. So the first one is our this Vet Access app. I just want to make sure you guys all know about this. This is something we're rolling out, and we're going to be rolling it out with a couple of partners as well. But right now it is free to any shelter. Currently, you do need to be a Best Friends Network partner. We're looking at expanding that beyond, but it's a real easy sign up to become a partner. But this is available to any shelter, so your fosters will be able to have access 24/7 to a veterinarian when your veterinarian is not available. Particularly with all these new fosters coming on board, this is really, really important for them to have this access. So we're offering this for free, and we're working with some other partners. Like I said, we'll be announcing more about this soon. But I did just want you to know that right now, your fosters can have access where the vet can give advice. They can't diagnose and they can't prescribe since they don't have a patient relationship, but they will be able to say if it's something that the animal needs emergency care for or needs to call you for. And it's just really to help the shelters out at this point in time. So we have more on our website, bestfriends.org, about that, and we'll be sending out a lot more information soon. So if you can go to the next slide. And another thing that Best Friends is doing, and that we're hoping to recruit others to do, is we're going to recruit 1,000 people across the country to it. We have an action team that has 11,000 people and growing right now who are wanting to do stuff, asking what they can do. So we're going to try and recruit 1,000 people to agree to fix community cats in their neighborhoods when they open up. And we're going to provide step-by-step and a plan for how they do this, for how they're going to connect, how they can actually plan, how we can connect them with spay neuter clinics. So we'll be putting this out very shortly. We're hoping for this in the next week, of looking for ways that you can promote this as well. Because we're thinking this is a great opportunity as people are home and they're connecting on Nextdoor and they're actually going out, and we're seeing a lot of people going door to door talking to their neighbors. Let's really focus in on getting more people to commit when the clinics open back up, that they're going to be out there trapping. So the burden is not on all of us who are already doing it, but we're bringing in a whole new crew. Just like we brought in a bunch of fosters in shelters, let's bring in a bunch of community cat people to help get more fixed. And maybe that will help take away some of the stress and the heartburn that we're feeling about this. Next slide. And The other thing, we're going to be doing we're going to be doing 2 more webinars actually. So there'll be another webinar. So look for details on that coming out hopefully next week, where we've put together some ideas of things you can do while you're shut down to still prepare for kitten and puppy season. So we're going to be putting out a bunch of ideas for you and resources, because we really want to focus on that positive of what you still can do instead of just feeling stuck. So we're going to be putting out a bunch of posts and memes that you can share on social media just to keep the spay neuter conversation going, and encouraging people when it is time and we do reopen to get their pets fixed and give them resources. So be looking for that coming up. We're really excited about what that webinar is going to look like. So next one. And then the big comeback. I mean, I want to call it a comeback, I guess, but we've got to come up with a big spay neuter push. And so this has been something that I'm so excited, because I actually just met with a group of people on Monday. It was national and regional organizations, so that we can plan on how we're going to do a big spay neuter push nationwide when things reopen, focusing on how can we help shelters get caught up with their backlog, and then how can we help spay neuter clinics, because we know financial aid is going to be a big thing. How can we do some blitzes? So we're working very hard on that. I don't have a lot of details yet, but I promise you, we got some cool stuff we're looking at that we're going to want you all to be involved with. And I think that part of this for us is also going to be supportive, just helping you if you have staff that you lost that didn't come back and you need to train new staff. If you want us to help look at your financials and help come up with a new plan, since this one's been blown to pieces, of, what can you do to get back on track and come up with some of that lost revenue, and what's this going to look like for fundraising. So we're going to have people available to help with that. So I think that is going to be something that is, stay tuned, because we're really, really excited about that. And I just want you to know, because sometimes you don't see things happening behind the scenes and you may think, well, who's doing anything? And I just want you to know that we are. And then just 2 more things, because I want to make sure that we have everybody get a chance to talk. But I want to talk about just a few other bright spots. So one other thing I think we can really be doing right now is something that Jacksonville Humane has done really well, is they have a Kitten Crusaders program. And so they get so many kittens. I know there's so many of you on this call who get this. I know Lifeline and APL of Springfield, you guys are on this call, and you're constantly getting kittens all the time. So they kept 1,100 kittens out of their shelter last year, so that when people either had their own cat that had kittens or found a stray cat. So obviously we want to work at identifying first, is that an owned animal. No, they walk through that whole process. But if instead of taking those kittens into the shelter, they actually have partnered with 5 private practices who will provide the medical care, and then the people foster them and find homes through their network. And I think what's really great about this is it's a great partnership between a shelter and vets, but it's also involving the person. So instead of going into the shelter, they're helping them stay out, and Jacksonville Humane helps pay for the medical care of the animals at the shelter. So this is a great way that maybe we as spay neuter people can really help prevent without them going into the shelter, and help people again be that resource for themselves. And it's a whole new way of thinking of it. So the other one I just want to talk to is actually, I'm going to let Dr. Levy talk about this, since this is her program, but I think it's another great one of keeping kittens out of the shelter.
Yeah, this is what our TNR program came up with. We call it the Kitten Shelter Diversion Program, and it's a collaboration with our local Humane Society and our local Animal Services organization. And when people call because they have mother cat and kittens in their yard, or they found a cat family and they're interested, as people are, in turning their kittens in, instead what we offer them is a free surgery through our TNR clinic. And the agreement generally is that they'll keep the mom, and then that they will then find homes for the kittens. And we actually don't tip the ears of the kittens, because we're expecting that they're moving these cats into adoptive homes. So what this does is allows us, again, to increase the reach of the shelter. We know not everybody will go to a shelter to adopt, but everybody has a different circle of friends that we're not currently reaching. So this has been incredibly successful. I think last year we did 500 or 700 kittens through this program that kept them out of the shelter. And it's a very economical approach for us. We actually also provide care for when people find like underage kittens and they're injured or sick, or have you or I will provide medication for them and vaccines for them so that they'll be healthy when they are ready for neutering. So this has been a really happy collaboration with the community. And when sheltering re-emerges after the pandemic, you're going to find that a lot of the inventions for engaging the community more and keeping pets out of the shelter and using the shelter more as a last resort are going to stick, and we are going to emerge as a stronger sheltering community. I did want to make sure that everybody is aware of this very important document that American Pets Alive has online. It is the COVID-19 Animal Shelter Preparedness Guide. It is full of protocols for running a shelter, spay, neuter, and adoption programs during this pandemic. And so there's no reason that everybody needs to research and write their own protocols. They're already here and they're being updated every day as things change. So highly recommend this resource, and we'll put the link in the chat and share it out after. And then finally, this is a newsletter that everyone should sign up for. You know, we are all being inundated every day from our listservs and all of the webinars that are being offered and overlapping, and all of the sites that are emerging that are trying to collect information to share, and it's really more than anyone can keep up with. So the Association for the Advancement of for Animal Welfare Advancement and all of these other partners have come together to sift through all of this deluge of information for you every day and provide you a digest so that you only need to look at one place. And this has been coming out weekdays around midnight, so please do sign up for that, and it will make it easier for you to keep up with all of the rapidly changing landscape. So I'm going to stop sharing now and move to some more questions that have come in that I'd like to have our experts weigh in on. So starting with Dr. Cannon, there's been a lot of discussion about the shortage of PPE for human healthcare workers and emergency responders. Veterinarians have figured out ways to preserve PPE, so why shouldn't they continue to perform routine spay-neuter surgery now?
Thanks, Dr. Levy. So I think you spoke about this briefly earlier as well in your slides, but really PPE, our masks and caps and gloves and gowns, they're not really the major consideration here anymore. Initially, we were certainly concerned about conserving those resources, and many of us received calls from our local emergency management teams asking for donations of unneeded supplies, and many veterinarians have already donated all of their extra supplies to their local human hospitals and public health departments. So, you know, veterinarians are already following the Association of Shelter Veterinarians guidelines for spay-neuter programs, and that document has excellent guidance on, you know, what's required for surgical attire. And our staff, our veterinarians and our technicians are really creative and resourceful, and they're already, you know, conserving a lot of equipment just on a day-to-day basis, even before this pandemic happened. So, you know, often people are reusing their caps and masks if they're not soiled. We've come up with lots of different ways that we can try to conserve our gloves and other PPE as well. The much bigger issue that you've touched on is really being able to protect our staff by helping keep them apart. And the safest place for our staff and our clients is to be at home, not in the shelter, not in the clinic, in those close workspaces, sharing the same air. So really at this point, we are looking at, this is not a PPE issue. The most important thing is being able to allow our staff members to stay home where they are safe. So our human medical experts and our public health experts are telling us constantly that the safest place for everyone is to be at home unless you need essential services like food and medication. And so most of what we do in sheltering, you know, certainly we have some essential services, but as we've talked about, spay-neuter is not one of those right now. So this is more important to be considering how we can keep our folks at home so they can stay safe and healthy, so that in a couple months we can be back at work and saving animal lives.
And Dr. Cannon, as a follow-up, what kind of spay-neuter surgeries would you consider to be emergencies?
Sure. So I think, certainly we've had a lot of discussions about this, but within spay-neuter, the emergencies are going to be things like pyometra, so infections of the uterus, and that's something that sometimes is easy to diagnose on a physical exam, or it may require more blood work or intervention to be able to diagnose that. But basically a pyometra, so an infection of the uterus, or a situation like a dystocia, so a difficult birth. So if a dog or cat is having difficulty actually in labor, so you might have malpresentation of a puppy, and even see a puppy or kitten that's lodged in the birth canal. So that would be an emergency that's life-threatening for that animal. And then also something like a vaginal prolapse. So that typically requires surgical correction and a spay. So those are things where if we delayed those, by any period of time, that could cause that animal's life to be threatened.
One other topic that's come up, well, two topics I think that are causing us the most heartburn are pregnant animals and tomcats that we're trying to place into foster. And so as a group, we've sort of agonized over the pregnant animals and kind of come to acknowledge that for the time being, we should not be bringing the pregnant animals into our spay-neuter clinics to spay and neuter. And that is something that's been a bitter pill for a lot of us. And other organizations, they've already stopped spaying pregnant animals anyway as part of their no-kill policies. So it's been an interesting discussion on that. And then we have been urging foster programs to be very innovative, taking in all these cats that are not neutered. And we know that male cats can be impossible to house inside without the spraying. And so some folks have said that they are going to continue to castrate the male cats that are going into foster or adoption programs because in a way they consider that to be life-saving or to avoid having those animals come back to the shelter. So we're all struggling with the fringes of the where routine spay and neuter surgery really are. Sharon, I'd like to switch gears now and talk about how many states require spay-neuter before adoption, but shelters have been encouraged to dramatically reduce intake and in-house populations to support being safer at home. And anticipated workforce reductions as the pandemic spreads. How should shelters handle spay-neuter requirements at this time? And Sharon, you're muted.
In Ohio, we do not have a spay-neuter before adoption mandate, and however, we do have an organizational mandate, and we have relaxed that. So we've basically suspended it. So I think for organizations in states that have not yet passed a stay-at-home order where pre-adoption spay-neuter is mandatory, now is the time to reach out to your governor, to reach out to your state veterinarian, to reach out to other policymakers, your state health department, and work with them proactively to ask them to relax that law during this time of crisis. And that has worked in a couple of states with those mandatory spay-neuter requirements. I think this is also really reinforcing that it is not a luxury to have relationships like this with our policymakers, with our lawmakers. This is where it gets critical to know some of these people so we can pick up the phone and say, don't forget us, we're out here, these animals matter, and our services are essential. So, but for anyone who either it's not a mandate or it's already passed and you're having to make life or death decisions for animals, you basically have three options. The first one, not optimal, is going to be to just hold them in foster in a typical traditional foster relationship until this all ends. Another would be to foster to adopt and put a foster to adopt agreement in, requiring that the animal, before it can be adopted, has to come back for sterilization, and then the adoption is finalized. And then the final, of course, is to find a way to do those adoptions and actually complete the placement, make it a formal adoption, but put a voucher and an agreement in place that those animals will come back for sterilization. And I think we have a good example to share of an addendum that you can add to your adoption, and you can modify, it's a Word document, to either your usual foster agreement or your adoption agreement that talks about what those expectations are going to be for folks that are taking animals in this situation. I think there is a question I saw in the chat asking, should we place animals in homes? The person who asked it practices Adopters Welcome and isn't worried about placing animals in homes with other unsterilized pets. Good for you. Mm-hmm. However, during these times, that might be something we want to go back and look at, or at least ensure that there's going to be a way that our foster homes or adopters are able to keep unsterilized animals separated so they don't get bred.
And Dr. Levy, could I jump in on that too? I checked in with our legislative team to see, because they've been really following a lot of the laws that are having some of these requirements, because people have been worried about how am I going to meet it if there is a law that says I have to do neuter before adoption. And so in Illinois, they're going to have to do all of their spay neuter within 14 days of reopening. And so there's been some, how's all that going to work? I see Sharon's face, which was perfect. Exactly. And so if anybody's having questions in their particular state where they're having a concern or issue, if you want to contact me, our legislative team is happy to help. They did suggest that you also check with the agency that regulates you. So if it's like the Department of Ag, see if they're allowing either telemedicine and then a vet statement to waive that requirement. But we also are going to be sharing, after this is over, a bunch of documents. So you'll be getting not only what Sharon mentioned, I think it's from Wisconsin Humane, has that foster to adopt. And there's a couple of other places that are doing some deposits. So we're going to be sharing that to give you guys some resources.
Dr. Cannon and Sharon, so much has changed in animal sheltering over the past few weeks. Is this the new normal?
Who wants to go first? I almost hope so. I think it's hard right now. I know as a person who, let's say, not a control freak, I'd say I'm a control enthusiast. This is a very difficult time for those of us who want to plan, know what's ahead. We have set a path and we have committed to this path that we're on that has been life-saving and to a large extent been effective. And yet now the game is changing. And I think we're being forced to look at things differently. We've been forced to really question the way we've been doing things. So I do think there are going to be some things that we're going to go back to, that it's a little bit the old normal. But I'm hoping that we're going to learn a lot during this time that we can take and completely turn our field on its side and find and learn that there really were better ways to be doing this that we've been forced to consider. So that's a yes and no for me.
I think that I can echo that too. We have completely changed our operations, I feel like, in just the past 2 weeks. And that's really a testament to the creativity and enthusiasm of our staff and the support, from our community as well, where, about 10 days ago or so, 2 weeks ago, we put out a call to our community asking them to foster our shelter animals. And within, about 48 hours, they completely emptied our shelter facility. And all of those animals are now in foster care, which is fantastic. And they're probably much happier there. But it does create a big shift on the requirements for our staff and how we support them. So, we've had to ramp up and cross-train staff so that now we have more people working on that foster program. We have volunteers who have been repurposed, and now they are trained to contact foster parents and provide a lot of support and follow up. We've shifted a lot to virtual and online communications. All of these animals, might have medical questions. And so that's being handled through telemedicine now, where foster parents are able to send in photos or videos, and we can communicate via FaceTime or communicate via email or the phone to be able to treat those pets and still provide the care that they need, but also protect everyone. We have also certainly had to think about how to counsel our fosters about these intact animals, right? And we necessarily didn't really have that situation before of having to explain to people what types of behaviors to look for and how to keep everybody safe. And so even when I was talking back about pyometra and dystocia and things like that, those are situations that our foster parents may have never experienced before. So we have to think ahead and be able to provide them with some guidance and some enhanced training and just tips on what to watch for while they're providing care for these animals in their homes. Our animal control officers are still doing their regular jobs. They're just doing that from the safety of their trucks and from their homes, and keeping them out of the shelter as much as possible so that they're not coming in contact with our animal care staff, who are still providing care for the very few animals that are there in the shelter facility. And we're still, providing those essential services of reuniting pets with their owners whenever possible. So we just have to alter everything so that we're not coming closely with members of the community.
I think I have also one thing I'd like to add is this time last year, we had more than 400 animals in our care. Right now, we have just over 200 animals in our care. So already that's dramatically reduced, and only between, on average, 20 to 30 in the shelter at any given time. And interestingly, we are not a community. And remember, this is the city of Cleveland, a very poor city and a challenged community. Our intake lines, our animal admissions lines, have not been ringing off the hook for people wanting to surrender pets. I know there have been some communities and some shelters that have indicated they have been seeing that, but we have not. And that right there makes me wonder, why that is, and what can we learn from that moving forward we can maybe change some of our deeply held convictions about what our role in the community is and how we can best serve animals. Wow.
That's so encouraging, how the community has responded to the requests for help, and really promising for the future. Sharon and Aimee, I've been hearing a lot from low-cost clinics and shelters that are worried about being able to pay their staff in the coming weeks, and even whether they will survive financially long enough to reopen in the future. What can organizations do in the face of decreased donations and revenue?
Well, I'll kick off and just say, as a nonprofit, my advice is fundraise, fundraise, fundraise. There are a lot of groups that are doing well with their fundraising right now. I think when you're doing that, you need to be really sensitive to the fact that people are facing their own financial challenges. But we did learn during the economic downturn in the late 2000s that if people were going to keep giving charitably, they gave to children and they gave to animals, were among the top causes that people continue to support. So I think with some creative and strategic outreach, we can keep a certain revenue stream of donations coming in, while on the other side, we are sadly having to look at reducing expenses. And for the vast majority of us, our people are our greatest expense, and many have looked at either having to do furloughs, layoffs, or put people on voluntary unpaid time.
Yeah, I'm definitely seeing that right now. A lot of the spay neuter clinics have had to go to that, and but I think there's a couple of good things coming from that. There is an SBA loan program, which I'm actually going to put, Best Friends just put together to try and help everybody understand that a little bit better, just put together kind of a resource to walk you through that. And I'll put the link in the chat in a second. But there are also some other good grants coming out. And I realize grants are not going to do it for us long term because they're small grants, but Banfield Foundation just announced today one for people helping unowned and owned pets, which is great for spay neuter. The ASPCA came out with some. The other ones I think are more a little bit shelter related, like through Petco and Pedigree, but we actually have a list. I think Maddie's fund put together a great resource that has a lot of different grants that are available. And we're also seeing a lot of community foundations, local community foundations that are helping for groups to apply for. And some of them are a lot of these are operational, which is great because usually you can't get operational. So I think we should definitely look at the grants that are popping up for emergency. We should really look at the SBA loans. We're really going to be looking at this federal relief and seeing how that helps. And I think with spay neuter, we're definitely going to see more people needing financial, but I think we're in a better place because a lot of spay neuter clinics can be self-sustaining through client fees and through a lot of the wellness and vaccines. So in our next webinar, we're actually going to be giving some resources on some virtual fundraising that spay neuter clinics specifically can do, and also how you can get some drive-through vaccine clinics coming up that can also help with some revenue once things reopen. So I think those are going to be things that help.
And one more thing that somebody in the chat mentioned that is true is the CARES Act did provide for some added donor benefits. I think it provides for an above the line deduction for donations up to $300, and then it changes the percentage of your adjusted gross income, the maximum amount, that percentage that you can also donate. So that would be a message, that would be something to message out to your donors.
And Dr. Hurley, one of our viewers is worried about all the cats that shelters are not taking in now because the NACA guidelines recommended reducing community cat intake. And a lot of the groups are saying don't kidnap the kittens. And what should we be doing to support cats that are out in the community that are not going to be entering shelters now? Can't hear you, Kate.
How about now?
Now, yes.
I think this is really a tremendous opportunity to reframe how communities think about cats and to recognize that we have never been able to take in the majority of cats in communities into shelters. If you do the math, there are 30 to 80 million free roaming cats in the United States that are unowned, and about 85 million owned cats in the United States, about half of whom are allowed outdoors. And on a given day, even in a given year, we take in only a tiny fraction of those cats. On a given day, if you do the math, it amounts to less than 1 in 5,000 to 10,000 cats in communities overall. So they are cats that are posing problems or concerns for people. But when we have taken them in without resolving those problems or concerns concurrently, which has been the historical model, we haven't done anything to change the instigating situation. What we know from return to field programs that happily pair sterilization with returning the cat is that intake has gone down in those communities by as much as 30%, and dead cat pickup has gone down by 30% or even more, suggesting that resolving the problem at the location of origin is more effective than what we have been doing. And even now, when we can't pair that with sterilization, we still have the opportunity and potential to leisure the time to actually have conversations with people about the problem. Who is feeding the cats? What is the habitat? What is going on there? And what are some solutions that will have a long-term impact? We've looked at dead cat pickup from shelters that discontinued intake of healthy free roaming strays. And we saw, even in the absence of a return to field program, there was no increase in DOA pickup. In fact, there was a decrease because we weren't removing cats, leaving a spot open to be filled by another cat that had to roam and fill it. So let's use this opportunity to really have those conversations, learn more about what's happening in our community, and educate people on the more effective response they can do instead of the easy pathway that's always been open to them in the past.
Thank you, Kate. And one of the questions I've seen or comments on the chat a few times is that our staff is coming in anyway to do their other tasks. So why shouldn't they be doing some spay and neuter while they're there? And our reply to that would be, we need to help our staff stay home more. So if they only have a half day of work to do, they should be allowed to go home and work from home, or whatever else is being done with people who are not at work. But they should not be held at work for a full shift if their essential duties are not requiring that. So with that, I
think that's so important, Julie, because I'm thinking about just how important it is that as we get tired, there's more and more opportunities for us to slip in our own self-protection and in the consideration we place to other, right? The 50th time you go through a door, you're not going to remember to sanitize that door handle or sanitize your hands after touching that handle. So the longer people are at work, the harder they're working, the tireder they are, the more likely there's going to be a mistake and a slip up, and the more likely that that slip up will have consequences for other people who are also tired and slacking on their self-protection. And I think we're all feeling that in the emotional strain of this. We're already tired. We're coming to work tired. We're waking up in the morning tired, right? And so thinking of ways to lower people's burden, understanding all the extra energy and adrenaline that we're all working under is really important. And also remembering, if we do this right, this is not forever, right? This is just short term. This is deferring. This is not stopping. This is stopping things that were never a good idea in the first place. But this is deferring things that we know are important and that we will rebuild the capacity to do. And we will rebuild it faster if we protect our staff right now.
And I think it's also hard because when you see that some clinics are still doing surgeries and you're not, you feel that like, well, I just want to go do it too because we need it so bad. And I think the thing for me is as much as I so want to say yes, 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 I feel like if we do that and we do put them at risk and one of our employees maybe doesn't have health insurance, gets sick and something happens, I could personally never forgive myself. And also thinking about, that they may not want to be put at that risk. We may want to do it, but they may not necessarily want to do it. Or maybe they do feel comfortable doing, but then they get sick and you're shut down anyway. So I think it's better if we can just say, look, we're understanding this, but we're going to get back sooner the more we do this right away. And we're planning for the big comeback. We will get caught back up. Even though it doesn't feel like it and we're picturing all these kittens being born, we're going to get ahead of this again.
I would urge everybody who has a stay-at-home order to read that order in detail. They're long, they're boring, but you really need to understand it as an employer. And for instance, Ohio's stay-at-home order requires that even essential businesses only have employees there that must be there to carry out the essential aspects of that business's work. So I think we do have a responsibility in this, in making those decisions about what we must keep doing versus what we don't have to, and making sure everybody else stays home.
That's good advice. And then we've also been hearing about what can employees do while they're working from home. And, some folks have jobs and tasks that are really amenable to working at home. But then others, if they're animal handling staff or clinic staff, this is a great time to catch everybody up on their online training. Fear-free training is free. And a lot of times staff didn't have time to do that before, and so they can catch up on modernizing and increasing their skill level. There's also a lot of protocol writing that we all would love to do that we never get around to, and this is a great time to pull the team together writing and updating protocols while they're working from home. And this is a time I think we have extended this time period, so we have some more time to take some chat questions. Andy, if you would like to feed us some of those.
If I can do a cat neuter start to finish by myself without using any human contact or PPE, is that acceptable? It's my site. And in parentheses, our team of 6 is down to only 1 person on site per day. And the context for this is we find intact male cats are very challenging to live with or get fosters adopters for.
So this was exactly my line of thinking, and why for my bucket of essential surgery, I was willing to put tomcats in it for exactly the reasons that are mentioned. Is I can do, as a veterinarian, the anesthesia, the surgery, and the recovery all by myself with nobody else in the building. So that's a very simple thing to do with injectable anesthesia, and it's not a major surgery. And I think it's a real concern about having cats in the home and not staying in the home because they spray. And we've all had that one experience of a cat peeing in our car or our home, and we know that all of the enzyme treatments in the world really never get rid of that odor. So I agree with the caller on that one. Now, what I would say, that's for in-house animals. We should not be opening to the public to neuter male cats that would be coming in and increasing our contact.
Okay, can we use, and sorry about my pronunciation here, megestrol or megestrol acetate at feral colonies not fixed yet? So
the Alliance for Contraception in Cats and Dogs has put up on their website, should be there now, instructions on how to use megestrol acetate for suppressing estrus in female cats. Their guidelines were written with cats in the home in mind. But anyone is welcome to look at those guidelines and see if it might work for the cats that you're caring for. A challenge is the specific dose needs to be given to each cat once a week. And so for a lot of feral cat caregivers, the logistics of assuring that are not practical. But for some of our caregivers who have done this in the past, they put it in a little bit of food and watch the cats eat it, and they have been successful. So something to consider.
Okay, I think this is something that Kate addressed in the chat, but I just want to make sure everybody gets a chance to weigh in. How would you respond to clinic clients that have animals that are going to need a rabies or distemper/kennel cough vaccine or 1 to 3 year booster during this time?
I can respond to that. So I think for the most part, that qualifies as not an emergency. Certainly the booster vaccines are not emergencies. Those vaccines are known to be protective. And I was just looking for some time, usually longer than the interval. Instead, it would be encouraged to, for puppies and kittens, encourage people to keep them safe at home, knowing that the risk, but for both the puppy or the kitten and for the person and for the staff, would be in the process of bringing them out to a shelter or a vet clinic for vaccines. For fosters, if it's a very low risk foster home, first time they fostered, only thing they're fostering, in fact, the risk of exposure to panleukopenia or parvo in that environment may be lower than the risk of venturing out for vaccination. And so those animals should only be vaccinated a week or so before they're going to go out and about into the world to get adopted or, after all of this is over, get sterilized and all of that. For foster parents that are in a higher risk environment, to the extent possible, if they're trained, provide them the vaccines, let them give them themselves so that there's limited human interaction. If that's not possible, still, do a transport, put them in a carrier, eliminate face-to-face contact opportunities, and provide the minimum vaccinations. It's okay to go out to a longer vaccine interval. So go out to a 3 to 4 week interval as long as it is a low risk environment. These people are staying at home. They should be staying at home, petting the animals, and not going out and about exposing them to parvo and panleukopenia. And I think just in general, I was actually trying to find a description of what veterinary clinics are being asked to limit their practices to, because there's a lot of things about, like, what about rabies clinics? What about dental stuff where the animal has really bad gingivitis? And all of these things that are not, like, you wouldn't bring that to an emergency clinic in the middle of the night, likely not going to make the cut of something that's appropriate to do right now. If you can wait in the time of non-coronavirus, then you can wait right now. Remember, we're not talking about 6 months even. We're talking about weeks to a couple of months before we can start to revisit these decisions. This is a critical time where the risk of rabies is probably lower than the risk of coronavirus, right? That's another fatal illness. So we got to really rethink it. Here's the list of, this is from some state veterinary association. Is the procedure necessary to save the animal's life? Yes or no? Is the procedure necessary to alleviate substantial pain or suffering? Yes or no? Can this be managed in a way that mitigates the human health risks of COVID-19 transmission between the veterinary staff, owner, and their respective families and communities? And would this procedure require the use of scarce personal protective equipment needed for critical human medical care? So I think those provide clear and narrow guidelines. And again, just like we want staff to be spending less time, we want to be doing less exceptions. So we want to be smart about the exceptions. We're like, this is a higher risk foster home. This person works with animals, or they've had litters in the past. We're not sure about it. Like, yes, okay, let's bring it in. Let's do it carefully. Let's really pay attention to every single step. But let's not try and do that with 50 animals in an hour or even in a day. Make sense?
Okay, so a couple of questions along these lines. How far in the future should we be canceling our public spay-neuter surgeries? We've been canceling 1 week at a time and seeing how things go. We stopped taking new appointments, but we have surgeries scheduled well into May anyway. Should I be canceling all of April, bite the bullet and cancel everything? My board is looking to me for answers, and I don't know what to do. This hurts.
I can share that from everything we're hearing, even from the president, is we should expect disruptions through May. Also, the Clinic HQ software that a lot of spay-neuter clinics use to run has got new modules to, rather than cancel all these appointments, is change them all to pending status, and Aimee may be able to provide more details about it so that they can be rescheduled easily as soon as you start opening up for service again. So it's a reschedule of information that's already in the system rather than canceling and rebooking.
Yeah, and I would definitely at this point, because I think it does look like it's at least going to be through May. I think if you try and do it week by week, you're just going to frustrate yourself and your staff having to go in and keep. So I'd rather go later and then be happy that great news, we can get you in earlier if things change. So I think definitely looking at just at least going till May at this point in time is probably going to be the best advice. And definitely looking at what Clinic HQ has with that. They have a lot of great options in there to do, and Gina can walk you through it at Clinic HQ if you aren't sure how to do it, if you use that software.
I also think that by clearing the calendar completely, it will allow you to prioritize the most needy surgeries when you start back up. So rather than sort of arbitrarily just pushing everything forward, you can clear that calendar and then figure out which animals either have a medical necessity or they're going for adoption, or for whatever reason they might be the top priority for you.
Yeah, and I think a lot of clinics are struggling with the fact that they already were booked out 2 or 3 months, particularly with female dogs, before this ever happened. So people are probably already feeling angst about that. So I've seen clinics that have tried to like do an extra day where they'll do just a female dog day to try and get caught up, or they'll do some special days to see if they can do a weekend clinic and have their staff either come in and get paid extra for that. So I think we're going to have to really sit down and talk, and I think we're starting to have pulling people together on really brainstorming some ideas of what are we going to do to get ahead of this and how are we going to schedule. So we'll hopefully be pushing out some information on those types of conversations in the near future.
Okay. As shelters change their policies to meet the evolving circumstances, how do you recommend they message to rescue groups in their areas regarding how to handle strays and owner surrenders? Many rescues are having a tough time dealing with the changes in policy and are ending up taking in the animals that are being turned away at the shelter.
Sharon, do you want to take that?
I think we need to message to our rescue groups the same way we're messaging to the public, and if anything, hope that they can be more willing and able to recognize the need to change what used to be a priority, and for now leave those animals who truly aren't at risk alone. So certainly if they're helping animals that they truly feel are sick, injured, in emergency and need to come in, whether it's to their own rescue or to partner with a shelter to get that animal help, that's one thing. But if we have folks who are still out there bringing in animals, and I would say especially cats that really can be sustained still on the street, make sure they're fed, make sure they have shelter. That's what we really need to be encouraging them to do. I know that's easier said than done in some cases, because we're all in this because we have a passion.
I think this is related. This is just a back and forth that's been going on in the chat, where ACOs are still picking up dogs because people call. This is a high-risk activity. This is something we would absolutely not recommend. This is against the NACA and endorsed national recommendations. And so I hope that you can send a strong message. One of the reasons we've all signed on, we've been scrambling to make all these documents and position statements that we've all signed on to, is to give you a big organization to throw under the bus. Throw us under the bus. Use us as a weapon to convey the urgency. It is irresponsible for field services to continue in that way. That is putting the field officers at risk. That is putting the public at risk as they go to home to pick up stray dogs that are not urgent. And it is putting your shelter staff at risk as they admit those animals, care for those animals, and then have to find an outcome. Spay, neuter aside, which was the issue that originally brought this up. But also, I think it's important for us to realize, like, the vast majority of animals that are dealt with in our communities are dealt with by us, by shelters. So if we do a great job, even if people are cheating, I know how frustrating it is. You're like, stop going out, stop going to the beach, stop going to the bar. But remember, if most of us do it right, most of the time, we will be impactful. We will reduce risk. We will save tens of thousands, hundreds of thousands of lives. So don't let the exceptions get under your skin.
There is a really fantastic Facebook group. It is the American Pets Alive Shelter and Rescue Support Group or something like that. It's got several thousand members. There's the pirate. And these kinds of questions are what are discussed all the time, is the really nitty-gritty operational questions that you need answers to, and you can find out how your peers are handling them in large and small organizations as well as rescue groups. So please do join on. They also have a conference call every Monday at 7 a.m. Pacific time, which is also very well attended and helpful.
And not used quite as much yet, but there is a national spay neuter network that I encourage all of you who are specific to spay neuter to join, because I think we could use that for similar discussions as well. Because I know one of the things, I know Natalie had asked in the chat if we are going to be changing how we start doing high volume check-in and check-out in clinics when this all ends. And I think we're definitely going to need to be looking at that. And Clinic HQ had been putting together some regular meetings and come up with some really great ideas on how we can do that, how we can do more things virtually. And I think we may find that how we do our check-ins is actually going to change and be a little bit more virtual, which I actually think could add to a lot more efficiency for us. So I'm actually pretty excited about it, and less stress in our clinics in the morning. So I think one of the things for me that's kind of been brought out in this webinar is a need for us, we've been having key people talk, but to bring a lot more of the clinics starting to be into this discussion now. So my promise is I'm going to be reaching out to a lot more of the clinics to kind of have these conversations.
Okay.
And just one more resource while we're talking Facebook groups. For field officers, and especially, where you have animal controls under a different umbrella than your animal shelter, they may really be out of this loop, and that's why they're going around picking up stray animals, because they just haven't heard the conversation of what's expected now. NACA, the NACA Facebook page, is really lively and active, and NACA has emerged as really supportive of animal control officers and keeping field officers safe. So make that reference for the field officers in your life.
I saw a number of questions about heartworm testing, and I thought we should address that before we go.
So what I've been seeing, we've been working the last couple of days trying to come up with an entire list of do this, don't do that, and the heartworm testing in general would be put aside because it's not an urgent procedure. If it is something easy to perform, like in some shelters, their ACOs draw the blood and do the heartworm test, that can be done, but you wouldn't want to pull teams in to do that medical care if it's not easily done. As far as treatment, we are not recommending that any new adulticide treatments start, although you certainly could start with the preventive and the doxycycline in the foster home to get them ready for treatment down the road. But we wouldn't want to be starting any high-risk procedures at this time.
Again, I think it comes back to that list of, is this life-threatening? Will this alleviate significant pain or suffering that can't be medically managed? And use your judgment on that. And sometimes being an intact tomcat with nowhere to go, it's life-threatening, and so it's justified, but it needs to be really evaluated thoughtfully on a case-by-case basis.
Julie, any final words before we wrap this up?
I can say that the information we shared today might be different tomorrow, that it seems like as we write protocols, they're almost out of date before we put the final period on them. So there has been no time like this to stay in touch with your support groups and your sources of information and to keep up, because it is rapidly changing. It's going to be rapidly changing on the human side as we watch the pandemic spread. And then our response as animal welfare advocates and programs will have to be nimble as well. And so stay tuned with us. There's a lot of unprecedented collaboration across our industry right now that is the bright spot that's happening, and we need to keep that going and emerge even stronger on the other side of this. I want to thank Maddie's Fund for making this webinar today possible and for supporting all of the groups nationally that are working so hard behind the scenes to get ahead of this. And with that, wish you all safety and wellness and hope and all of the strength that you need to get through this. We'll all be working very hard together.